a time I used evidence-based practice.
Yeah. Was there something from your research class?
Um,
Was
no,
that
I wish.
um,
Would that be, can I ask you like what they're trying to figure out from that? Because I'm sure I have a story, but I just like, I'm like, was I supposed to read a research article and then be like, I'm gonna apply this here? Or,
yeah, so it's kind of hard. Like as a student, your only experience with this is like if you did a research class and you made a poster or like somebody made you do a project or you like did a
oh,
quality improvement thing. Other things people talk about is like if they went with their preceptor to talk through like the bundle for how to prevent CODIs or CLABSIs or like falls or something like, did you guys ever talk about how to prevent
I
catheter?
wrote a pa I wrote a paper on class Bs or whatever. I wrote a paper about class Bs. And I know things about how to prevent them. I don't think like I've not inserted I haven't had anything to do with like inserting them.
No,
Like,
no, typically we don't.
yeah, I don't know if it's like I know like it's not ideal to have it in the inner thigh and that it should be taken out as soon as you can, and there should be certain procedures. Like I know the procedures for
Yeah.
that. I read a lot of like research and stuff for mental health and like read a lot of additional materials on like trauma informed nursing care, and I think it really taught me better tools for communication for people going through mental health crises and traumas, and it was something that I was able to use on the floor during my mental health rotation a little bit when communicating with these patients. So
Oh,
maybe
I like
could I
that.
talk about that? Yeah, sure.
Yeah.
I can
I mean,
expand on
I'm
that.
trying to think like these babies, it probably won't help you with the babies, but it'll help you with the parents.
Yeah, yeah,
A lot of these mothers have been through stuff, you know?
yeah, and it's like I can imagine. I mean, I can't really, but I can guess how traumatic it is, especially if your baby doesn't make it. But yeah, I guess I'll answer the question. During my mental health rotation, I was able to read just a lot of research studies and a few books about trauma informed care and nursing. And these research, this evidence based practice gave me the tools on how to, on the signs and just how to assist someone who's going through mental health crises and having issues with their mental health. Just learning different ways of communication, um, really making sure that I have open body language, that I'm non judgmental towards these patients, that I let them express themselves, really just allowed me to help kind of walk them through their really tough experiences in a non judgmental way where they could express themselves. I think these tools have helped me in every situation since I've learned them. I did use them actively in the mental health rotation, but even in the ER, seeing kids come in with a really bad injury and the parents being really scared because this is the first major injury that the child has had, I was really able to, um, I think, help the family work through these scary issues and really care for their child in a physical way, but also in the whole family for the whole family in a very psychological way. And I think they're tools that I use every day in nursing and outside of it as well.
This is amazing. Yeah,
Oh,
use
thank
that.
you. Thank you. Thank
Yeah.
you. Thank you. Okay, I'm glad. I didn't know how to answer that one earlier, too.
Yeah, that's perfect.
Glad we had that.
There's something called National Patient Safety Goals. If you hear that term, they're talking about four things, which is CODIs, CLABSIs, falls, and pressure injuries. I feel like the low-hanging fruit for that is CODIs, right? Because you can talk about doing peri-care and like sterile insertion technique and making sure that the bag wasn't on the floor, that the tubing wasn't on the floor, that you like assess the daily need for like do they actually even need this, um all that kind of stuff. Do you
Hmm.
feel like you could like give that one a go?
I could, or also like a fall patient.
Falls. Yeah.
Yeah. So there, I'm just laughing because I didn't know how this patient did it. But anyways, there was one patient that had very severe dementia, and if you put her in bed too early, she would like try to get out of bed on her own. So I we found her fallen on the floor a few times. So what we did was to prevent the falls, I would always stay close by to that room, but also we would just keep her in the chair a little bit longer so that way she could kind of roam around in the wheelchair versus trying to get out of bed by herself and into her chair, because that was most of the falls were because she was trying to get out of bed on her own. And even though we would keep the call light close by, she wouldn't use it or wouldn't remember to use it. So to prevent those falls, we'd always have someone close by, but we would just put her in her chair and just reposition her like every few hours in the chair too, to prevent the pressure injury as well. But that helped a lot because she didn't like to be in, obviously, who wants to be in bed? But if we put her in bed too early, she would try to get out and fall. That's not a very good answer, but
So the thing is, like, I get it because I worked in a nursing home, and I know, like, you cannot watch these people the way that you're
yeah.
expected to watch people in the hospital, you know?
Mhm.
If you had had a patient that had fallen twice on your, like, in your care in a hospital, they'd be like, what is she doing? I feel like talking about preventing UTIs
That's
kind of,
better.
it fits like their environment that they've worked in. Because if they've never worked in like an LVN job or like a LVN type facility, they have no idea what it's like to take care of like 30 patients. Like, you
Yeah,
can't
that's
hold
true.
30 patients in the bed and like round on them every 15 minutes. You just
Yeah,
can't. Yeah.
yeah, that's very true.
So I would go with you want to try it for preventing UTIs?
Yeah, so I wonder what route, because I had a lot of patients with catheters.
What about the lady that
Oh,
that
the one
was
that
like
got
really scared
sepsis.
about it? Like, talk about all the things you did to ensure she wouldn't.
So we already had orders like put in place, obviously, to provide like peri care, like clean the catheter. I would just make sure to do the cleanings of like clean her peri area.
They usually have
Make
like
sure.
CHG wipes, like a CHG bath is kind of this like the gold standard.
Oh, they had
Yeah.
us use soap and water.
You could do soap and water. Soap
Yeah.
and water's
Okay.
fine. Yeah.
Okay. Yeah. So they'd
Just
have
like Harry Care with an approved solution, whether it's soap and water or CHG.
okay.
Yeah.
So I would provide her peri care during my shift with soap and water, the approved solution we had at the facility, just to make sure that the tubing is clean, as well as making sure she's staying hydrated, just to try to prevent her from getting a UTI. And I also had the charge nurse do a like a what is that called?
The audit?
Like when you have gather everyone just to go over the skills, because a lot of
An in
people,
service?
yes. So I asked the charge nurse if she could do an in-service of the sterile technique for the urinary catheter, because a lot of people I noticed weren't doing it properly.
Okay,
So
that's right.
yeah, I feel like
And there's kind of, let me tell you just kind of like the standard bundle for like the hospital. So usually they have you do every 12 hours, they have you document that like um the patient still has a need for it, and like that the need is like appropriate. So because if you have it
mhm,
in and they don't need it, it's just like an unnecessary risk. And then
yeah.
making sure that the bag is not on the floor, that the tubing isn't on the floor.
Oh, okay.
But
Making
like
sure it's
it's
like
what's that?
attached to the proper part of the bed or
Yeah, so that
okay.
it's off of the floor, and then also that it's below the level of the bladder so that there's no backflow. Um and then like any time that it's emptied or like a sample is taken, like making sure that it's done in a way that doesn't introduce any bacteria. Um Not letting the bag get more than 2/3 full. um Pericare, sterile insertion. Yeah, if you mention that stuff, then they'll be like, okay, cool, like caught, because the reason
Mhm.
they care about it so much is like, let's say, especially if you're going to work in NICU, like let's say a baby gets sepsis and like the infection has some sort of lifelong effect because the hospital caused it, because it was catheter associated, they have to pay out for that. And imagine paying out for that over the course of someone's entire life. That's a lot of money.